Why is coenzyme Q10 is so important supplement? Information is collected from various scientific journals to create awareness. It is advised to seek consultation from qualified physician before administering coenzyme Q10. Key properties of Q10. Coenzyme Q10 plays a key role in the electron transport chain by providing an adequate, efficient supply of energy. Coenzyme Q10 has large molecular weight and is not soluble in water, hence absorption of dietary CoQ10 is slow and limited. The Tmax is around 6 hours, with an plasma elimination half-life of about 33 hours. Who all should take coenzyme Q10? 1. Healthy aging adults and athletes. 2. Patients with cardiovascular diseases. 3. Patients with type 2 diabetes. 4. Patients with chronic kidney disease. 5. Patients with liver disease. Healthy aging adults and athletes. Most of the body's daily coenzyme Q10 requirement is derived from endogenous synthesis, and this is known to decline substantially with age and cause degenerative disorders. Oral supplementation with coenzyme Q10 significantly benefit against degenerative disorders, thereby promoting longevity. Athletes may suffer from marginal CoQ10 deficiency, and adequate dose of supplementation may be useful to recover their performance. 1. Patients with atherosclerosis. Atherosclerosis has been explained as a simple arterial lipid deposition with concomitant loss of vascular elasticity. Coenzyme Q10 is a multifunctional molecule that could revert most of the cellular alterations found in atherosclerosis. 2. Patients taking statins. Cholesterol biosynthesis and coenzyme Q10 endogenous biosynthesis share a common pathway. Clinical trials have proved supplementation by coenzyme Q10 ameliorate these deficiencies. 3. Patients with chronic heart failure. Study was conducted on 400 patients with chronic heart failure, and the primary long-term endpoint was time to first major adverse cardiovascular event. Supplementation with coenzyme Q10 reduced the risk of MACE by 42% and reduction of about 40% cardiac-related and all-cause deaths. Patients with type 2 diabetes. Firstly, a number of studies have identified depleted blood coenzyme Q10 levels in patients with type 2 diabetes. Studies have shown that coenzyme Q10 supplementation in patients with impaired glucose tolerance could slow the progression from pre-diabetes to overt type 2 diabetes. Patients with chronic kidney disease. Plasma coenzyme Q10 levels have been reported to be significantly lower in CKD patients, with or without hemodialysis, compared to normal controls. A study with 97 CKD patients were given supplementary coenzyme Q10 for 3 months or placebo. There was a significant improvement in markers of renal function in coenzyme Q10 supplemented patients compared to placebo, in both dialyzed and non-dialyzed patients. Patients with liver disease. The liver is the major site of coenzyme Q10 synthesis in the body. In patients with liver disease where metabolic capacity has been compromised, a reduction in coenzyme Q10 production is likely to have a deleterious effect on heart function. Studies showed reduced coenzyme Q10 blood levels in NAFLD patients. Non-alcoholic fatty liver disease, NAFLD, is a risk factor for cardiovascular disease, which has been reported to be one of the major causes of death in NAFLD patients. Who should avoid taking coenzyme Q10? Chemotherapy induces an increase in coenzyme Q10 levels in cancer cell lines. Coenzyme Q10 increase is implicated in the cellular defense under chemotherapy treatment and may contribute to cell survival. The American Cancer Society concluded, coenzyme Q10 may reduce the effectiveness of chemo and radiation therapy, so most oncologists would recommend avoiding it during cancer treatment.